Hi, everyone. My name is Wayne, and I want to share with you some content that I first presented at the meeting of the Gaucher Community Alliance on October 24th, 2022, at our first meeting in Minneapolis. This is going to be a little bit strange for me because I don't have anybody here with me to give me any kind of feedback. So here I am just talking to a green dot, and I hope this is going to translate well into a shareable video. Let me share with you my presentation slides. See if I'm doing this right. So far, so good. Okay, it's working. All right. So what I want to talk about today is called the elevator pitch, explaining Gaucher to your new provider in less than a minute. Now, let me explain what I mean by an elevator pitch. And I'll do this by means of an example, because it really did happen to me in an elevator. I was a docent for amateur ham radio at the Museum of Science and Industry in Tampa, Florida. And I got in the elevator on the third floor, and I'm wearing a badge that says amateur radio operator. And someone looked at me and said, "Amateur radio, what's that?" Now, the doors are closing. I have exactly as much time as it's going to take to go down one floor, and the doors open, and I have to blurt it out. And I felt a bit tongue-tied. What am I going to do? So that's where the phrase, the elevator pitch comes from, the term, because you're really pressed for time. And on my way to Minneapolis, on my way to the hotel after I arrived at the airport, I had a car that picked me up, and the driver is being very nice, very friendly. Outside of New England, people are much friendlier. And he said, "What brings you to town? Why are you here?" And I said, "I'm presenting at a conference." "Oh, really? What's the name of the conference?" "It's the Gaucher Community Alliance." And he said, "What's that?" "Well, Gaucher disease is a rare disorder, and this is a group of people who are interested in that, and they're getting together for the first in-person meeting in a long time." And he said, I guess the words that we fear the most: "Gaucher disease, what's that?" "Okay, you're on. Now what do you say?" And I said a few things. I mean, you can't go too far wrong, but it is possible to get down in the weeds and not get your point across. I got to the hotel, and the bellman, of course, is being very friendly, because in Minneapolis, people are friendly. And he said, "What are you here for?" And I said, "I'm presenting at the Gaucher Community Alliance meeting." "Oh, great. Gaucher, what's that?" "Okay, I'm on again." And this time we were in an elevator too. So it really was very appropriate. So the question is how to present this in less than a minute when it really, really, really is important. So let me get a few things out of the way as we're talking here. My name is Wayne Rosenfield, and I had a lot of assistance from my daughter-in-law, who has several degrees in communications, and especially medical communications. And believe me, getting her help, this got better by one full letter grade. And let me explain what my affiliations and disclosures are. At one time or another, I have presented on behalf of any of the pharma companies that you've heard about related to Gaucher. I've also presented at classes as an invited lecturer in mechanical engineering at Tufts University, and to first-year students at the Yale University School of Medicine. I told them about Gaucher, and they were very interested. I have current consulting contracts with Takeda and Pfizer for doing various types of consulting and education. I'm treasurer of the Gaucher Community Alliance, a volunteer position, no money. And I'm a professor at National Louis University in the Tampa campus in a graduate program that trains future psychologists. And everything to do with this Gaucher Community Alliance meeting and presentation and everything here has been at my own expense. And this is what a psychologist looks like. My daughter-in-law has no relevant institutional or corporate relationships to disclose. She did marry my son. And actually, both of my sons are in this picture. One's holding the chuppah, and one is getting married to Dr. Chelsea. The elephant in the room is that there is this mutation. This is how you spell N370S in 4 letters. These are the nucleotide sequence for the N370S mutation, the most common mutation that is related to having Gaucher disease. So added to the problem is that we have a rare disorder. People haven't heard of this. And as I'll be honest with you, what you have is so rare, we're not even sure that we're pronouncing it right. And that's actually part of the problem too. But medical students hear about it. They may hear about it in medical school. I had this conversation with my geneticist at Tampa General Hospital, the person who orders my medicine. And she said, commonly, it's a name on a table of diseases, of disorders. And people hear about it. They hear about it in a broad classification, but most physicians will never see a case of it. So here's more of the problem. I want to tell you a little bit about our mutual friend, Maria. Now, Maria had exactly the same mutation as me. Our Gaucher mutations were identical. We were also both asplenic. We've had our spleens removed. And Maria would often say that, yeah, we're cousins, distant cousins, but we're actually maybe a lot more like siblings. We're both band people. I mean, she's a woodwind and I'm a brass, but you know, we should pardon the expression, play together. And we did a lot of activities together. In fact, Maria and I were both at a meeting, was sponsored by Shire some years ago. Neither one of us were speakers at the meeting, but we were just there. And there was content being presented by Shire clinicians. And there were a bunch of patients there who had never before been to a Gaucher meeting. And they asked us, those of us who were there, who had prior experience with this whole Gaucher thing, they asked us to give a few impressions. And I remember what Maria said. She said, of all the bad things that happen, the best thing about having Gaucher is the people you meet. And I remembered that. And then November of 2019, I got an email from Maria's boyfriend. And he told me that Maria had died. And this was, of course, a shocker. Maria had developed sepsis, and I didn't ask for any of the details. I don't know any of the details. I just know that she and I are at risk for extreme infections, not having a spleen, and that's a common circumstance for people with Gaucher. There are acute problems that may apply to people with Gaucher, and you've heard this all before. There's bleeding, bone crises, bone infarctions, bone fracture risk, spleen enlargement, liver enlargement, infections, gallbladder inflammation, on and on. There's more. And this is not an exhaustive list. When I look at this list, when I made this list up, I'm thinking, what are the things that I've been through? Yeah, bleeding, bone crisis, bone infarctions. Actually, I did fracture a bone one time I slipped on the ice. I had an enlarged spleen, which had to be removed under emergency conditions. I've never had liver involvement for some odd reason. I have had infections. I had gallstones, and my Gaucher doctor was quite insistent that I needed to have that removed. But I never developed inflammation there, or pancreatitis or liver infection. So it's not an exhaustive list, but you know the things that can go wrong. And we've talked about that. In people with Gaucher, what seems like a routine, non-urgent problem can progress to become a more serious systemic problem. For example, where do you get an infection? You can have an inflamed toenail. You can have a cold. You can have an upset tummy. You can have a urinary tract infection. You can have a cold. Did I say cold? A cold, which is an upper respiratory kind of thing. You can have bronchitis. It could progress to something more serious. But even if it isn't something more serious, you have all of these things that can affect you. But consider this. Here's a little graphic from the Centers for Disease Control. Here are the 4 types of infections that are often linked with sepsis. It doesn't have to be something dramatic like a postoperative infection. I've had that too. And that's pretty dramatic. But you can have a lung infection. You can have a urinary tract infection, a skin infection, a GI tract infection. We've all experienced these things, and they're fairly common. But we need to be prepared for the next emergency. Are you waiting until you get around to it? Well, here you go. Here's your round to it. And now we're ready. And I'll tell you why this became a crisis for me. And we'll talk about part one of the solution. But let me just divert for a few minutes to tell you why this was important and why I told you about our friend Maria. I got that email from Maria's boyfriend in November 2019. 2 months later, in January 2020, I had what was not a terribly uncomfortable bellyache. It was bothering me during the week. I thought that because I had been exercising, I had maybe exerted myself too much and pulled muscles or something. Pain in the abdomen, I can tell you from having a splenectomy, is very non-specific. You just know that you feel kind of, something's wrong. And at the end of the week, it wasn't going away. In fact, I continued to work out during the week, but it didn't go away. And I went to the ER because at this point, I got something, and I don't know what it is. So I went to the emergency department, and there I gave my spiel to the ER doc, just kind of casually. I have Gaucher disease. Yeah, I've had all these different problems. I am asplenic. I've had a bleeding issue. I've had an infection risk. I've had avascular necrosis. I have yada yada, the whole story. And she said she didn't think this was terribly crucial, or it wasn't urgent, whatever was happening to me, because I didn't have a fever. I wasn't screaming in pain. I looked basically all right. But here's where this was a remarkably good ER doc. And she said, I don't think it's anything, but you've had so many weird things happen to you. Let's just get a CT before you leave. I said, okay. So I go and I have a CT scan of my abdomen, and I'm back in my examining room in the ER, and I'm putting my shoes on, and she comes in the room and says, you have appendicitis, and it's bad. It's really bad. You've got a serious case of appendicitis. You need surgery now. They admitted me to the hospital, and my surgery was scheduled for the next day for an appendectomy. This turned into a big deal. This laparoscopic appendectomy, which is how they normally do appendectomies these days, by simply a smaller kind of least invasive kind of thing. This turned into a big deal. And the report from my surgeon when this was all done was, quote, "It's been years since I've had to do that," which means he had to abandon the laparoscopic procedure. And I woke up with yet another abdomen long open incision. And I say another one because it's right next to my splenectomy scar, which gives me kind of a map of Amtrak on my abdomen. So it's been a big deal. And I'm talking to the hospitalist and going through the whole Gaucher thing. Now, let me back up a second. I hope this isn't too disorganized. But when I was in the ER, and suddenly I realized that I am carrying in my abdomen a major source of sepsis, of septic material, that if this thing goes even worse than it is now, will release into my abdomen. This is a very, very bad situation. The ER doc had correctly sized up the seriousness of this. And I was able to say, we need to call my Gaucher doc. And fortunately, we were able to find my Gaucher specialist, who was very happy to give the emergency physician guidance on what kind of antibiotic I should be on, what they need to do for me immediately. And the emergency physician was very grateful for the advice. I mean, they want a good outcome. And I was started on the correct antibiotic. So the first thing I did was verbal. And what I'm talking about here is a plan for how to address the issue of dealing with a previously naive, that's a a scientific term. Naive means not previously exposed. A previously naive emergency physician, or it could be any physician, who is brand new to the issue of treating someone with Gaucher disease. Now, they've heard of it, and they understand the basic chemistry and the physiology of it and what's going on, but they haven't dealt with this before. You need to do a verbal presentation of what's going on. One of the things that would have been helpful for me would be to have a rehearsed presentation. For example, I have Gaucher disease. There are factors related to my Gaucher disease that are important for my health and may affect your decision making. Here is where to find the technical information you need. If I could give them a quick reference, I was able to give them the telephone number of my Gaucher specialist, and that was extremely helpful. But you know, you may not know what kind of work I've done as a psychologist, but I did spend many years in hospital emergency departments. I see how ER docs work. They work under great pressure. They work under great speed. And when they encounter something that they're not greatly familiar with, in northeastern Connecticut, for example, I heard the ER doc talking about dengue fever. Well, you don't usually see that in rural Connecticut, but he was dealing with that. So what do? They go to this in-service database, and they look up the latest information. Generally, the information they get is very, very good. In fact, when I had a hip complication and I was an inpatient at Tampa General, I had this conversation with the attending physician, not my orthopedic surgeon, but the internal medicine hospitalist. And he came back with a printout, 20 pages from this company. I'll show you a sample of what kind of information there may be. But he came back with this digest of information, and he let me have it. And I read the whole thing over, and it was good information. It wasn't, naive information that leaves you with a lot of unknowns. It's a roadmap for the physician who wants to have a good outcome for what to do. So I would say it's important to remember this, learn this. You may not remember it when the time comes, if you ever need it, but you know that this is what you want to say. The script is intentionally short, emotionally neutral, and respectful. Now, one of the experiences we have as people involved with Gaucher disease is that we know a real lot about it. And you are very likely to know more about it than most doctors. You may not know the body physiology and the chemistry in minute detail, even the genetics, but you have a lot more experience with everyday dealings with Gaucher disease. I have kind of a funny example that came up about 2 or 3 years ago, where there was a Facebook group. I think there still is a Facebook group. I'm not currently involved with Facebook, but the Facebook group, and somebody said, I just got diagnosed with Gaucher disease. My doctor wants to do a liver biopsy. Well, we have a lot of experience as a community knowing what a normal assessment would be. CT scan, MRI, X-rays, blood work, maybe a DEXA scan, physical examination, things of that sort. Something as invasive as a liver biopsy is not the norm. I'm sure there's things that a good physician, a pathologist can get from a liver biopsy, but that's not the norm for what we experience. It may be the right thing in some cases. I'm not telling you, say no necessarily if your doctor tells you that you're going to have this. So the Facebook group blew up. No, don't let him do that. That's terribly out of the ordinary, which it is. And so imagine what the scenario is. The person goes back to the doctor. This is a doctor who's never seen Gaucher, never seen a Gaucher patient before. And I'm always telling professionals when I have a chance to talk to them, if you have never met a Gaucher patient before, let me tell you, they're smart, they know what they need, and they will tell you. And I said this at a rare disease conference. It was before 2019, maybe it was 2017 or 18. And I looked out over the crowd when I said this, and nobody disagreed with me. These are people who know Gaucher patients. Nobody disagreed. They're smart. They know what they need, and they will tell you. So imagine the situation where this guy, whoever it is, goes back to his physician who has ordered a liver biopsy and say, I'm not going to do a liver biopsy. Well, why not? Well, my Facebook group said not to do that. Well, what would you think if you were the doctor? Well, you have your Facebook group do your diagnosis for you. You ask Dr. Google, what kind of treatment you should get. In this case, your friends on the internet, your Facebook friends, are absolutely right. I mean, it's probably not the right thing to do at the very least. I mean, it could be the right thing in some cases. I don't want to give you like blanket, advice here, and I'm not giving you medical advice, but it's not the norm. And as a community, we know what the norm is. So this person gets information off the internet from Facebook or Google and goes back to the doctor. The doctor would be, I think, very justified in feeling very skeptical of this and thinking his patient is a little bit making bad decisions by relying on the internet. But the fact is, in this case, that would be true. So you want your information to be short, but respectful too. Yes, you're the doctor. You're not going to have a good experience with the doctor if you are aggressive or confrontative, or actually what I have to be careful of is sounding like a professor, because it's easy to do. So with a new medical provider, you want to be assertive, but not aggressive. Authoritative, that is having good information, yet respectful. Yes, you're the doctor, and I'm consulting you because you are the one who can help me to have a good outcome from whatever it is that's happening. On the other hand, I, as the Gaucher patient, have some experience and perhaps even some knowledge that the doctor does not have. And that's a tough message. So we want to be kind of low key about this. I saw this quote some years ago, and I've been repeating it ever since. I love it. It's attributed to Maya Angelou. I believe that she's the originator of it. I don't know, but I keep repeating it anyway, and allowing the proper attribution of it. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. If you're coming in with guns blazing and you're aggressive, they're going to get the impression, whoever it is and whatever you're doing, that you're aggressive. And it may not work out quite well. So the verbal response is part of it. Part two of the solution, which I'm going to try to explain to you, and we can find a way of these handouts. A tangible but simple handout. You need to communicate to your medical provider that there's some essential information that you need to know. Now, I've said this a couple of times already, but your medical provider wants to have a good outcome. And it's not just about avoiding legal liability. People are in these professions because they want to do the right thing. They want to do the right thing. And one of the worst types of anxiety comes from ambiguity. That when you're not sure of what the proper course to follow is, it's really unnerving. So we want to remove that ambiguity. Here's what you need to know. Here's what's important about me that can become a very bad problem very fast. You want the information to be authoritative with a link to comprehensive, factual information and concise, because a long discussion is going to exceed the attention span or the patience of a busy provider. Now, again, I told you I spent a number of years working in hospital emergency departments. There was one day, and I just use this as an illustration. I had a good relationship with the ER docs. And one of the ER docs had been working on a trauma that had come into the ER somewhere else in that department. It wasn't something that I was at all involved with. And I was dealing with my own case, psych case, that was very ambiguous. And I really wasn't certain yet what the problem was or what we needed to do. So I had an ambiguous report. But the patient had been around for a couple hours in the department, and I thought that I should give some kind of report. I went over to the ER doc and I started talking, started telling him what I'm thinking. Yeah, I'm not really clear, not really sure. We're still working on this. I need this information. Well, he had a tiny drop of blood on his lab coat from the trauma he had been working with. And I'm in the middle of this very ambiguous report, and he says, "Oh, there's a lady with lab coats." Somebody was bringing him a new lab coat. And I thought this was his patience and tolerance for my ambiguity quickly exceeded his attention span. And he wasn't being nasty to me. He was just directed elsewhere. In another context, we might call that an attentional deficit, which it could very well be. The handout could be a card. What if you had just a little card that you could put in your wallet and you could present what's important for them to know and then take it to the next level in terms of what is the information that they're going to need for the complexity of dealing with a medical problem. So I developed this, an information card. Now here's two sides to the information card. On the left side of the screen, you see the logo for the Gaucher Community Alliance and a place for your name, date of birth, and a simple statement. I have Gaucher disease, a potentially life-threatening condition that is rarely covered in medical curricula. This is a very simple, short sentence, but actually, Chelsea and I worked on this for a while to keep it as short as possible, but we wanted to convey the message that we are not treading on your medical education. We recognize that there are, this is what's implied in this whole statement here. We recognize that there are 7,000 rare diseases affecting 30 million people. Medical education does not cover 7,000 rare diseases. There are broad categories. And my first semester of grad school, the first autumn where I was not in college anymore, I was in graduate school, one of my college classmates called me from a very famous, highly regarded medical school where he was a first-year student. And he said, he called me on the phone, one of those things with a dial and a cord. It's really, I haven't seen that in a while. But that's how he called me. I picked up the phone and he said, I heard about your disease today. Here's how the lecture went. There are the lysosomal storage disorders, Fabry, Gaucher, Niemann-Pick, and others. And in 4 years of medical education at a highly prestigious, well-regarded medical school, that's what he heard about Gaucher disease. And that is not atypical. There's a lot to cover in medical education. They cover, in some cases, for example, in the lysosomal storage disorders, broad categories. And they have some recollection that there is a thing called Gaucher disease. And I mentioned earlier, I had this discussion with my geneticist, the person who orders my medicine at Tampa General Hospital, and she orders my enzyme replacement therapy for Gaucher. And I asked her, what gets covered? Because she's involved in a teaching hospital. And she said, generally, it's in a table of diseases. Here's broad categories of diseases. She's had me come in a few times to talk to her residents and fellows, and there may have been some medical students there. I can't tell you they were terribly interested. They were, it's a hospital that has a McDonald's in the lobby, so there was a lot of crinkling of paper going on, but they got something out of it. So we want to say that it is not often covered in detail in medical curriculum. Not saying that you're poorly educated, doctor. So we're saying that this is something that you rightfully know. I mean, a good scientist will know. I'm not an expert on this. It's just one of many things that will come my way. We all have individual significant risks, and I mentioned some of those earlier. I know for me, for example, historically, I've had thrombocytopenia, which is low platelets causing me to bleed. Not so much of a problem since 1993 when I began enzyme replacement therapy. I've had infections. I have a history of a total splenectomy, and that means I'm asplenic, which makes me at risk for things. So my co-occurring condition might be asplenia, or had a splenectomy, something like that. I added this thing on medications because I asked one of my colleagues, an ER doc, who also teaches at Yale. I said to her, "What do you want to know for a Gaucher patient who's just coming in?" The biggest thing on her mind was, I need to know the medications. That's very, very important. We need to know what's already in this person, and most important today. And that takes some discussion. It's sort of ambiguous. I have an infection. I have a bellyache. I have some unexplained bleeding, something. On the other side of this card, and I'm going to show you how to make these cards. You make it, and you'll get a sheet that looks something like this. And on the other side, the name of your Gaucher specialist, someone who really knows you, but also knows Gaucher. If you don't have a Gaucher specialist, I do recommend that, because this is a rare disorder, and physicians, no matter how smart they are, can't know everything. They try. I mean, I would try, certainly, to know everything. A good scientist knows the limits of his expertise, knowing what you don't know. Now, I'm finding in my experience in the ER and also with primary care physicians who have never seen Gaucher before, they're very, very happy to have the name of your Gaucher specialist. Now, I go to a Gaucher center every year for a comprehensive assessment of my Gaucher status. And my medical providers, where I live now in Florida, are very happy to get the report and the recommendations from my Gaucher specialist. It's not just about limiting liability, although that I'm sure that could be part of it. They want to have a good outcome. People go into these fields for the right reasons, I believe. I'm still idealistic enough. That's what I think. That they wanted to help people, and they don't want to mess up. So you give them the name of the person who knows you and knows Gaucher. Your ER doc also needs to know your primary care provider, because that's the person who's most attuned to your current situation, when you had your last flu shot, for example, and what kind of complaints you've been coming into the office with. Now, that section on medical resources, let me explain. I told you that when I saw an ER doc in northeastern Connecticut looking at a case of dengue fever, I don't even know what that looks like, but this is what he was diagnosing. He pulled up articles that would be important for him to know. What's the current literature on this? And by literature, when a scientist says literature, what's the current publications and peer-reviewed resources that say this is what the standard is? They're obligated to provide service that is the standard of care. Like, what would a person anywhere in the world get as the proper standard of care? And wherever you are, that's what you have to do as the clinician. So we have three resources here. One is from the National Library of Medicine. The other one is from PubMed. And the last one is a link to information that we have on the Gaucher Community Alliance site. And I wanted to put that there because we have complete control over what's said there. So what you do here, this is the Office Automation 101. And here's how you're going to do this. You go to Staples and you buy business card blanks. This is Avery printer paper number 5881. And you buy it. And inside, what you get are a bunch of cards that look like this. And these fit into your printer. Okay, got that part out of the way. And what you do is you go to Microsoft Word. Now, I'm sure this could work with other editing programs. I have all Apple equipment, but I don't use the Apple software. I use Microsoft. And you create what you see here. You paste in. Now I'm hesitating, and the reason is I've got both sides of the card on this. You'd make one card like what I have here. This is all the front side of the card. In a separate file, in Microsoft Word, you would use the same template and have the other side of that card. So you're going to have a whole sheet that looks like this. You put print blank into your printer and you print off of Microsoft Word. And what you'll get, I didn't print it onto one of these cards. They're kind of expensive, so I didn't want to waste it. But you'll get cards on this paper, but this is what gets printed with side one, and because you put it in again when you printed side two, and side two. Then you break these cards off. They're perforated. I don't know if you can see that here. Yeah, you can. They're perforated. They break out, and you can make yourself your own individualized wallet cards. Now, I made this to be a generic template, but you can certainly personalize it where it says name. You put your own name, your own date of birth. You can print it with your information. I do advise you to go very simply. Be simple. Be simply. What word am I looking for? Do this very simply, because you don't want to exceed the attention span of whoever you're talking to, but you want to give them the maximum amount of information in the least amount of time. And so keep this uncomplicated. Now, I'm referring to something, an incident that I saw in an ER, very specifically. There was a woman who came into the ER, and I never saw this person. I had nothing to do with this person, but the nurses did want to show me that she arrived with a big book, a big notebook, and it was plunked down on the nurse's station. And what this notebook said was, here, this is me. I want you to be able to see me as a person. I want you to know all about me so that I'm not just a case. And I can empathize with this, and I understand. And it's not a bad idea to want people to understand you as a person, but know that when you're in an emergency department and it's an emergency situation, nobody's going to sit and read your biography. No one's going to read examples of poetry that you find meaningful. No one's going to look through your scrapbook of important events in your life. That was all in this. And I can appreciate that somebody really wants to be known as a person, not just a case. But you don't need that at this moment. This is not a dating service. This is a hospital emergency department. And if you have an infection, if you have, for example, an appendix that is on the verge of rupturing, releasing toxic mass into your abdomen, as I was, you need to be able to quickly convey information. No muss, no fuss. This is not about forming close personal relationships. It's about conveying information as quickly as you can, and the essential information that's important for the person to know. The emergency provider needs those links on the card that provides the kind of medical information as I've been describing. See these handy links. Provide the kind of medical information that an emergency provider will be looking for. If you follow the first link, you get this. And this Elsevier is the service provider that I've seen used in the ER. Many times hospitals have a subscription to this service. And just in such a situation, not just in the emergency department, but anywhere in the whole healthcare organization, the providers can access this and get current factual information. Now, you see, this says a date of December 22nd, 2021. It was first received by the publisher on July 27th, 2021. This is pretty up to date. And the other thing that my eye is drawn to on this is that we know some of these people. We know Dr. Özlem Gaucher, we know Heather Lau, and Neil Weinreb and Gregory Grabowski. I don't know the others, not that they're not fully qualified Gaucher specialists, but my eye is drawn to people who I know to be experts in the field, and that this is going to give us the kind of information, going to give your provider the kind of information that your provider is looking for at that moment. Here's the reference for it, but not that you need that because you're not doing a library search. So you want to be ready for the next emergency. You practice the verbal script. You have a card to hand over. And we call them emergencies because they're unexpected. We're not ready for the next thing that happens. So you have a card in your wallet or someplace where it can be pulled out quickly. You say, whoops, I know you have a fender bender and you bumped your head and you're not feeling quite right and you feel like you can't think right and you need to go to the ER. You have this card in your wallet and it can be pulled out quickly. In a crisis, you may not recall your planned script. I'm going to go one step further from my own advice here. You're not going to remember your planned script. And I have another example of when that happened to me. I went to the circus. My father brought me and my kids and the whole family to the circus. And I like the circus. And I like pizza. And after the circus, he brought us out for pizza. And there was a commotion on the far end of the restaurant. And one of the wait staff started walking toward the rest of the dining room saying, "Is there a doctor here?" Now, clearly somebody had just collapsed. And I'm a psychologist, so what am I going to do? Not that kind of doctor, but I do have formal training in CPR, cardiopulmonary resuscitation. It's required when you work in places like that everybody knows how to do CPR. So I went over there. But there's a guy, he's fallen and he's on the ground and he's starting to turn a little blue. And I froze. I forgot everything. Fortunately, there's a little thing comes out of the social psychology literature. When one person responds, others will follow. That was a good thing. But I went back to my nurse educator the next day at work. I said, this is what happened to me yesterday in that pizza place. And I just forgot everything. What you need to do is bring this doll, the doll that you do the CPR on in the trainings. You need to walk into a place where nobody's expecting it, throw her on the ground and say, cardiac arrest, and see what happens. In an emergency, you're not going to remember stuff. Whatever you do remember to say will be good. I have Gaucher disease. I have this card in my wallet here. Take a look at this. Now, it's a good idea to practice this. I'd be looking for volunteers. Someone who can practice to become comfortable with this. When you're not in an emergency is the time and place to get over feeling inhibited and nervous. Let's get some volunteers.
Adams. Here. Adamley.
Here.
Adamowski. Adamson.
Here.
Adler.
Here.
Anderson. Anderson.
Here.
Bueller. 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 Bueller.
He's sick. My best friend's sister's boyfriend's brother's girlfriend heard from this guy who knows this kid is going with the girl who saw Ferris pass out at 31 Flavors last night. I guess it's pretty serious.
Thank you, Simone.
No problem whatsoever.
Fry.
Okay, you get the idea. That was a little interlude because you've been listening very attentively. The best plan is to never have an emergency. Don't have an emergency. Okay, but life happens. Be well, stay strong, laugh some part of every day, eat right, exercise, manage your overall risk factors and your individual risk factors. Already have a plan for when things do go bad. Don't live in dread of the next bad thing that may happen to you. Live joyfully with the strength that comes from knowing that when things do go bad, you already know what to do. I created this whole file and it's yours. Use it. Just tell everybody where you got it. But there's no, I claim no copyright restriction on this if it's going to help you. I want you to use it. Just give me credit if you would. Thank you very much.
You're still here? It's over. Go home. Go.
Thank you, everyone. Bye. Be well.